Would you know what to do if you had a tooth knocked out? Well, the vast majority of us don't know the right steps to save that tooth. 2822 Eyewitness News Health Beat reporter Mark Keller explains what you need to do if you or your child experiences that trauma.
Kingston dentist Lauren Grossman demonstrates on one of his office workers what a typical oral exam looks like, but something he's often done for real.
Oh, yes. It's not uncommon.
Is treat a patient who had a tooth knocked out. Recently, he says that patient was a Wilkes University wrestler who was in the good hands of the wrestling staff.
Those people know exactly what to do because they've been trained to do it.
But the American Association of Endodontists says more than 90% of U.S. adults do not have a clue, which is unfortunate given how many times tooth loss happens.
We're seeing about 5 million teeth a year actually being knocked out.
American Association of Endodontists President Stefan Zweig says start by picking up the tooth by the white part or crown and avoid touching the root. Then you want to make sure the tooth is clean.
And the way you'll do that is by gently rinsing it with either milk or water. And then the next thing you want to do is actually replace the tooth into the socket from where it came.
Make sure it is stabilized too. And there is one last thing to consider. Remember, you're on the clock.
The key is time. More than 30 minutes, it's less successful. Within that 30-minute time frame, could be very successful.
That's what happened in the case of the Wilkes University wrestler who Dr. Grossman treated.
We had to implant two teeth and splint it, and it turned out to be very successful.
With the Health Beat, Mark Keller, 2822 Eyewitness News.
And dentists recommend wearing mouth guards during sports or even activities like bike riding and skateboarding to help prevent possible tooth loss. Head to PAHomepage.com to learn much more about good oral health and saving your teeth. What's 82 feet